Hey, you guys. So it's Sonia. Yes, I'm at work. It's the end of the day, and I just got some stuff on my mind. I want to get it off before I forget. So it's been a lot going on. Friday, I took off from work, basically a mental health day. I did nothing but crochet my little heart out. I rested, which I really needed because it was a very stressful week dealing with the mammogram stuff and being called back and finding out I had cysts from 2019 that nobody ever told me about. So I very much needed wine and rest and crocheting and movies and documentaries, and that's what I did. Saturday, I finally pulled up my garden, got everything taken care of, put my pots up, pulled up, the veggies and all that stuff, threw that stuff away because it's cold and it's not growing anymore. So I'm still sore from that. And then Sunday was a rest day. Wasn't feeling the greatest. I woke up hurting. My body was hurting, not just from what I did in the garden, but weather related arthritis. Then, on top of all of that, I'm still like upset about this whole mammogram thing. And it's like I'm in this place of I want to do something. I want to take this up higher. I want to go over heads. I want answers as to how something so important can be overlooked. How a radiologist didn't think, whoever that the radiologist was back in 2019, how they didn't feel that it was important to let me know either in a phone call or in their letter telling me that, hey, we found 4 small cysts in your left breast. Like, how do you not tell me that? That's for, do you know what could have happened in a span of 4 years? Like, how that could have turned cancerous. And thank goodness it's not cancerous, but still, I keep hearing stories from other women who've had these things missed or not told to them. And then when it is discovered, it's cancer. It's like, that is so unacceptable to me. So I told you guys I reached out to my primary. I sent her a note. She has not responded to me. And I think I sent this to her Thursday, either Wednesday or Thursday, and she has not responded. And my husband was like, of course she's not going to respond because they know they're wrong. But I'm like, I want answers. I don't care. I want answers because between the radiologist and her, one of them should have told me something. Like, hey, just a heads up, your latest mammogram show that you have some cysts, but it's nothing to be concerned about. They're super tiny, but just an FYI, you do have them. That's all they had to do. That's all I would have wanted. And then that would have saved me the freaking out and being upset when they called me back. Because then I would have been like, this must be about the cysts. I hope the cysts, didn't turn to something bad or. So all of that is on my mind. And like, I'm praying about it. I'm praying to let it go enough so that it doesn't bother me. But it's just, y'all, it's not sitting well in my spirit. It's just not. And I want answers. And I am going to contact somebody with Ascension to find out why. Why was this not conveyed to me in letter, over the phone, something? And just kind of go from there, because at the end of the day, y'all, you have to advocate for yourself, for your health. Nobody else can do it for you. You got to do it for yourself. And when things aren't right, you got to speak up. If you got to go over heads, you go over heads. But we just can't let things go, because when you let things go, you end up in the grave. It's too late. Things are so far gone and there's nothing anybody can do for you. I don't want to be in that position, and I don't want to be known as somebody who did not fight for herself. And I want my kids and I want my girls to fight for themselves too. Don't be complacent. Don't just sit and wait. Don't just, not take any action and you haven't heard anything from the doctors or anybody for weeks or months. That is unacceptable. You need to know what's going on with your health, what's going on in your body. You need to know why. I understand that doctors and nurses are extremely understaffed and overworked, especially since COVID. So many have quit. They're just burnt out and they just simply cannot do it. And I know staffing, doctors and nurses and CNAs is hard because people just can't take it. It's too much. And COVID is still out there. They're still dealing with COVID people in the hospitals. Hospital beds are still full of COVID patients. And these nurses and doctors, they are overworked and they're stressed. And I get that. So things are going to fall through the cracks. And this is why we need to stay on top of our health. We need to follow up. If it means calling these doctors or hospitals or doctors' offices 3 times a day, messaging them through MyChart every single day, that's what you have to do. That's what you have to do to get answers and to find out what's going on with you. Okay, you sent me this letter in the mail. I need you to tell me this in layman's terms. I need you to break down and explain to me what everything means. And you know what? Going forward, that's what I'm going to do with every single mammogram. Whoever the radiologist is, I'm going to contact that person. I'm going to contact them and ask them, please explain this to me in layman's terms. Because those letters are full of doctor jargon, doctor lingo. And the average person does not understand that crap. And they know this. But this video is just a reminder. Just giving you guys an update of where I am. It's Monday and it's the end of the day and got a lot of things just running through my head, but otherwise I'm okay. I'm okay. I hope you guys are too. Talk to you later. Thank you all. Whoever is watching these videos, please keep the comments coming. Please share your stories. Breast cancer, mammograms, whatever it is, whatever struggles you've had dealing with the medical doctors in your health, share those stories because I want to talk about it and I want to make this a safe space to have these conversations. So thank you so much for all those who comment, doctors, nurses, all of you. Please continue to chime in and give advice. Any and all advice is welcome. Thank you so much. Bye, you guys.